I'd have to think about it a little bit. Oh, it's no, that one. Sorry. Okay. See if we have it actually though.
Pardon? No. You want me to turn it down?
They had a crypto, blood and a CSF, and the LIC in the blood was 4, and the LIC in the CSF was 8. I wanted to rerun it to see if it was 4. That's like kind of the march of error. The twofold difference is expected, and
All right.
I don't think we have this.
Yeah, I'm paying attention. Yep. We have
We might have
19 on so far.
probably.
And I have 2 o'clock straight up. Let's go ahead and get started. We could at least do introductions. My name is Karen Stiles. I'm State Training Coordinator here at the Nebraska Public Health Laboratories. And today I would like to ask my replacement, Ben Ayers, who's going to be doing the talk today, to go ahead and maybe introduce himself. Tell us a little about you.
Yeah, hi, my name's Ben. I come from the microbiology lab. And we also have Becky, not just
And Ben, bring up your camera if you could. There you go. Yep, we got it. So Ben will be handling the presentation part. If you have questions, please put them in the chat, and we will probably hold off until the end of the presentation to go through questions. So, are you ready? It's all yours.
Okay, thanks everyone. Welcome to the Gramstein webinar for the laboratory generalists. Our objectives today, after this webinar, we'll be able to explain the Gramstein procedure and some different things that can make them go right or wrong. We're going to interpret gram stains from direct specimens and pure cultures. It can be a little bit different. And then we're going to look at common pathogens, especially from blood cultures and from sterile body fluid or tissue. We're going to try to interpret the gram stains. So why do we gram stain? We're looking at a couple of different things here. A gram stain really allows us to assess the quality of a specimen. If it's especially something like a sputum, you might see a lot of epithelial cells, not a lot of white blood cells, kind of telling us that our specimen maybe should be recollected. It tells us a lot about the bacteria that are present, the gram reaction, positive or negative, morphology and size. We can start to glean some information from that. Specific infectious agents will then, be obvious to us with the gram reaction and the morphology. We want to correlate that with culture growth. What we see on the gram stain is what we see growing on the plates. We want to correlate with culture independent methodology. A lot of places, positive blood cultures will do the biofire from the bottle. If we see gram positive cocci chains, we want to see Coccus or strep on the results of that culture independent method. And then physicians are going to use this to guide presumptive antibiotics moving forward. So the gram stain, we differentiate bacteria based on the composition of the cell wall. Our gram-positive bacteria have a thick peptidoglycan layer that really holds on to that crystal violet and the Graham's iodine. Forms a complex in the cell wall. Gram-negative bacteria high in lipid content, they have an outer membrane, which when decolorized washes out that complex, so they actually have more room to take up the counter stain, which is why they appear to us pink. So the basic premise is the crystal violet, all cells will take that up. The iodine forms the complex, sticks to the gram-positive decolorizer. Depending on your location or your site or your lab, mixture of acetone and alcohol, there's different compositions. But that dehydrates those lipids, allows the crystal violet complex to wash out. And then safranin is the counter state, which turns our gram-negatives pink. So different sample types. CSF and sterile water fluids are often going to be filtered, centrifuged. We have a cytocentrifugation method that we'll talk about. Blood culture broths going to be just drop taken directly from the bottle, put on the slide. Tissue, we want to do a touch prep where you actually take a little piece of tissue and just lightly touch it to the slide in a couple of different places. Try to get a good representation there. Tissue homogenate, we're going to grind up our tissue in saline. We're going to use the top of that homogenate directly to the slide. Swab material, wound swabs, you want to roll onto the slide. You don't really want to go back and forth. You want to keep as much as that cellular material intact as you can. And then sputum and exudates, these are you're going to be, putting your own swab into the sputum sample, and then you want to roll that onto the side. Don't forget to label your slide. We want to use pencil here because oftentimes the decolorizer will take off any kind of ink or label you're using. And that crystal violet can really darken your label, make it kind of unreadable. And then at this point in the procedure here, we're going to perform all of this sample preparation under the BSC. We don't know if these samples are positive or what the causative agent could be, so be as careful as possible, right? So here we go, CSF. CSF greater than 1 mil, we're going to centrifuge that. We're going to do the cytocentrifugation. Per your laboratory policy, Becky and I were speaking about, we have different times and RPMs for our cytocentrifugation in our lab. So per your laboratory procedure, greater than 1 mil, you're going to put directly onto the slide, spread it out. And then that cytocentrifugation, there's a little filter pad with a hole cut out of the middle. So the bacteria that we're looking for will be spread out inside that little hole. What's important about this is you really want to mark that area on the slide with a glass cutting pencil or something. Oftentimes CSF is fully clear. If you don't mark your area on the slide, you're not going to know where you're looking or what you're looking for. Positive blood culture bottles. This again, it's direct patient specimen, so we're going to do this under the BSC or with the face shield. We're going to use a syringe or a blood culture transfer device to remove a drop of blood from the bottle. We're not going to do this, don't do this right when you get the bottle in the lab. It hasn't been incubating long enough. You're not going to see anything in there. And then most blood culture systems use the buildup of CO2 inside the bottle to flag positive. So if it flags positive, it can be pressurized. So you want to be careful about that. And then you're just going to take 1 or 2 drops, put them on the slide, and use some sort of sterile stick to spread to thin monolayer. Blood cultures, they can be a very thick specimen. So you do want to try to really spread that out. And then your anaerobic bottle can wash away pretty easily. So it might need a couple extra minutes of setup time. So here we have our tissue and homogenates. So I kind of touched on this earlier. We're trying to hang on to the cellular characteristics of the white blood cells so we can see them intact. We want to see those neutrophils. So we're going to cut our tissue into smaller pieces, and then using sterile forceps, again, we're just going to touch the tissue to the slide. And then depending on, different labs have different tissue grinders, but we are creating like a liquid homogeneous. So we just want to take 1 or 2 drops of that and then spread it out on the slide. So you want to do your slide first and then set up your media plates. Hopefully they're sending you 2 swabs, but if you just have the one, do your slide first and then move over to your media broth. So this is, you're going to use a rolling motion back and forth over the slide to form a nice thin layer. If you rub it, you can tear apart those white blood cells, those epithelial cells. Can be harder to make sense of the specimen you're looking at. And then this is just like the wound swabs that we just received. But when you're looking at that sputum sample, you really want to search out the areas of the sample that look like are more infected. You want to look for the pussy specimens and the bloody specimens. And then again, you're going to roll that onto the glass slide. And then you can't even dilute extremely thick specimens with a drop of saline. And then this would be from our 18 to 24 hour culture growth. You're going to take a drop of saline and put it onto the sterile slide. What I do is, if you're taking a glass dropper, you put the saline on the slide, but then you want to actually collect most of that extra saline back up into the dropper. Otherwise, you're going to be waiting a long time for that to dry. So then again, sterile applicator stick or your wire needle or loop, spread that out, make a nice mono layer, and then let it air dry. Different ways to fix our specimens to the slide. So you can allow your slides to air dry under the BSC. That's just laying them out on the table and letting them dry. A lot of times blood cultures will be heat fixed, and that kind of destroys a lot of the extracellular material, making the bacteria a little more obvious and not so much background noise, but overheating them can cause over decolorization. Again, you want to do this in the BSC because you know it's a positive sample, but you know what it's positive with. Methanol fix is another method where you apply your specimen to the slide, then dunk it in methanol and let that air dry. And that does actually preserve some of the cellular material we're looking for like white blood cells. So here we go, the gram stain. So most places have a gram stain sink. It's going to be very dirty, very dark. You're going to put your slide on the rack over the sink, and then you're going to flood the whole slide with crystal violet and let that sit on there for about 1 minute so the cells can really take that up into the cell wall. Gently rinse with flowing tap water. You want to try to get all that extra crystal violet off of there. Then again, gently flood the slide with iodine, again for approximately 1 minute. This is going to form that complex in your gram-positive bacteria. Wash away the extra iodine. Decolorizing it's kind of an art form. So you want to decolorize kind of quickly and gently. And kind of what I do is hold your slide upright, start at the bottom, go up, then back down, and then hit it with the water again. And then you're going to, just like the other 2 stains, flood the slide with safranin. And you can leave the safranin on for a little bit longer to get a better counter stain. Some people have to do that with some gram-negative bacteria. You're going to rinse it again, and then you're going to let it dry with any of the methods that we just talked about. Oh, sorry, no. You're going to let this one air dry, or you can take a little paper towel and just kind of blot it off if you're tough on time. And then, but you do want it to be dry before you run it under that oil. So now we're moving over to the microscope. When you're looking at a direct specimen, gram stain, you want your white blood cells in the background to be pink. You want to be able to see what they are. And so you're going to search for areas with white blood cells present. More white blood cells in a specimen kind of indicate a more active infection. So if you're dealing with things like sputum, you might have thicker areas of specimen, thicker areas on the slide. So you kind of want to find a good representative representative area on the slide. Yeah, with white blood cells, but not a place where there's so much specimen that the crystal violet is really clogging up your viewing area. So, and then we're going to quantitate those things. So LPF there, that's low powered field, that's your 10x. So if you see one white blood cell per low power field, you're going to say rare, and then our quantitation goes up from there. We're going to do the same thing on our high power field. This is your oil immersion. We're going to do the same thing with quantitating the bacteria. You're looking for good representative areas. You want to do 10 to 25 fields. Some bacteria like Haemophilus can be kind of tough to see when you're scanning your slide. Oftentimes, like a sputum will have more than one organism present. But the same way we quantitated our white blood cells, we're going to quantitate our bacteria. So if you see 5 clusters of gram-positive cocci, we might say few gram-positive cocci in clusters as our quantitation for our report on this. And so here's just an example of our gram-positive cocci in clusters and this precipitate over here. You can get an idea of here's our size difference for the white blood cell. So this precipitate is really uneven in size, and it's kind of all over the place. These are more uniform. They're clustering like our grapes. So watch out for that. So our bacteria, classifying bacteria from gram stain. This is where gram reaction is going to be first and foremost. It's what we're looking for on the slide. And then we'll start to pay more attention to morphology and arrangement. But what do these mean? So your gram reaction or your gram positive, your gram negative. There are different bacteria out there that will stain irregularly, and you'll get some colonies that look pink and some that look blue. You'll notice if you're working up a culture that patients who are currently being treated with antibiotics, the colonies on the plate might look weird, and these have a tendency to decolorize easily. Same thing with bacteria that's more than 24 hours old on a plate. So we talked about those excessive thick areas like in the sputum. So that's going to catch a lot of that crystal violet complex and not be washed out. This makes it a little more confusing when you're trying to interpret your gram stain. So here's our morphology. We've got the bacillus, the rod-like gram-negative rods, gram-positive rods. Cocci are going to be round or slightly oval. They'll be small, and yeast can have this little bud on here. They'll be kind of round and oval, but they'll be obviously larger than your cocci. And then some pretty common arrangements that we see in the lab. You can have single cocci. More commonly, you'll find them in pairs or chains or clusters. And then these diplococci, these are actually gram-negative. Single pairs, chains, grape-like, and tetrads are going to be more commonly gram-positive. But these are gram-negative diplococci, and they do kind of have this little kidney bean shape, and they'll be in pairs. These can also be kind of hard to spot on the grams. So here, let's look at some arrangements. Here's our pairs. That's pretty obvious in there. Chains. These are our clusters. These are red blood cells, so you kind of get a size differential. Tetrads. And then here's our gram-negative. This would be like our Neisseria species. You can see there will be a little white space down in the middle of these. That's what you're looking for your diplococci. And then here's our yeast. Here's our budding yeast, and here's some gram-positive cocci and clusters. So you can tell the difference in size here. Okay, so arrangements. You can have gram-positive, gram-negative rods. Gram-positive rods more commonly you'll see with spores in the middle, which will be these obvious little white spots. Coccobacilli, like here, Haemophilus, are very tiny. and those are going to be gram-negative. And then your palisading and your Stonehenge-like, these are going to be like your diphthroids, gram-positive rods, and they'll be stacked like this, and like Stonehenge, they'll be kind of back and forth. So here are gram-negative rods. And we don't usually put these into arrangements. We don't say gram-negative rods in chains. We just say gram-negative rods. Here's our gram-positive rods. Pretty obvious there. Here's gram-positive rods with spores. You can see how obvious that spore is in there. This one's a little harder to see, but it's there. And then these here. And then some of these in here, it's kind of hard to tell. These are our gram-negative coccobacilli. These are, they're very small, even under oil immersion, your high power field. So they can blend into the background quite easily. So you really got to pay attention for your counter staining here and look for that against the difference to your background. And then this is kind of just comparing the two morphologies. Gram-negative rods versus your coccobacilli. Oh, so gram-positive rods. These are our Corynebacterium, our diphthroids. You can see they're doing the palisading. They're stacked up on top of each other. These are Stonehenge-like. This one on the left, some palisades there. And then sometimes you will get some stranger things like a nocardia or a propionibacterium that will stain very irregularly and be very difficult to see in your gram stain. Keep your eyes out for those too. And then here's some branching yeast, looks like. Your Campylobacter.
Go back to that last one. I think that was like a nocardia. You're right. It's hard to tell if it's a mold or a yeast that could be branching. But I also think it could be a gram-positive rod, but branching too. So there are some gram-positive rods that branch as well. Thank you. Sorry about that, Ben.
Campylobacter, which can be found in blood cultures. These are going to be little gull-winged bacteria. They're kind of curvy. In school, it was described to me as the Mazda sign. Kind of easy to remember. So just a little bit different there too. So our quantitative and qualitative analysis are helpful moving forward with the culture. Interpretation of poor specimens can lead to delayed or inappropriate treatment. If maybe a specimen's not rejected for too many white cells, patient might begin treatment unnecessarily. And then again, we can use these criteria for rejecting the specimen. There's different ways to keep score. You can just count up your total white blood cells and epithelial cells you see. You can create a ratio between them as rejection criteria. And then direct specimen smears, sterile sites are critical. And if you see bacteria out of a sterile site specimen, you need to call that to the physician or caregiver. So turnaround time is important for that. Really, we're looking for, again, those white blood cells and those squamous epithelial cells and the bacteria. And so when we get these critical results and the turnaround time is relatively short, the doctor can see that gram stain result, see it's gram-positive cocci clusters, start to put together it's probably a Staphylococcus species and begin treatment for the patient. CSF is definitely a critical value if that's positive. Most labs will have you call directly to the physician. And then they're going to start to put together that positive gram stain with the patient age, the physical examination, the local epidemiology, and the lab analysis. So just as a quick example, we'll look at bacterial meningitis related to age. So in neonates, commonly, causative agents of bacterial meningitis are E. coli, Klebsiella, Enterobacter, group B, strep, and listeria. And as we start to get a little older, group B, strep again, E. coli, Haemophilus influenza, causative agents. We start to see the strep pneumo and the Neisseria meningitidis. And then as we continue to go up in age, those strep pneumo and Neisseria meningitidis really become bad causative agents of meningitis. Okay, so we're going to move on to blood cultures. Well, blood cultures, it's important to correlate the positive bottles with what you're seeing on the gram stain. You'll notice here most common agents of nosocomial bacteria, the coag negative staph, but also most common contaminants, coag negative staph. So that's why we're looking at one bottle positive versus two is the difference between a contaminant and a workup. Common contaminants are your diphthroids, which are your palisating, Stonehenge-like gram-positive rods. Bacillus are large, boxcar-shaped gram-positive rods. Your alpha hemolytic strep would be your strep pneumo, strep viridans. Propionibacterium acnes are little gram-positive rods. When you're looking at your blood culture smear, your gram stain, and if you see gram-negative diphthylcocci, gram-negative coccobacilli, and large gram-positive rods, you want to move that work to the hood. Some labs take the plates to prevent the next laboratorian from exposing themselves, but until you can rule out that that's not a BT organism, you want to just be careful proceeding with that culture. Our stains, we're going to store at 15 to 30 degrees. Like I said, that decolorizer is a mixture of alcohol, so it is flammable. We want to keep it in the flammable closet. The gram iodine can break down in light. When we're looking at our slides as a quality control measure, we want to be able to see that our background material is a light pink and red. You know, you can see the nucleus of those neutrophils. And for our bacteria, we want to use known organisms because then we know how they stain. We can stain them ourselves. So a lot of labs will use E. coli and Staph aureus to QC that gram-positive and gram-negative stains. And then always correlating with your growth and your culture. If you see something on the slide that's not growing in the culture, or you see something in the culture that wasn't on the gram stain, you're going to start asking questions, maybe re-smear the specimen. So most labs will have a rejection policy for stuff like sputums. So we talked about that a little earlier. There are certain things that can affect the quality of your gram stain. The specimen can be too thick or thin. So you're either going to get a lot of precipitate or you're going to get a lot of washout. The age of the bacteria, as they get older, they start to decolorize a little easily. We talked about the precipitate and the reagents. So this is like if your crystal violet starts to go bad, it'll start to kind of precipitate in the bottle. So you're going to see that on all the slides you do that day, if that's your situation. And again, if the patient is being actively treated with antibiotics, you're going to see some weird things on the gram stain. So these are all things to note. If you do start to see some questionable results. So there should be a system to review gram stain reports. A lot of times this is done on the bench by the bench tech. They're looking at the gram stain first, and then they're looking at the culture in correlation. Supervisory review of final culture reports. This will also often be looked at when the culture is finalized. If you start seeing multiple or specimens coming in from the same location, somebody's going to have to talk to the lab director over there start getting some better specimens. So common morphologies and their associated organisms. Gram-positive cocci clusters, this is mostly going to lead the physician to think Staphylococcus and the laboratorium. Cocci in pairs, strep pneumo, classically, it's kind of those elongated cocci in pairs, and they can have, they can be encapsulated as well. Take a look at that. And then cocci in chains is your streptococci peptostrep. When you see large gram-positive rods on the gram stain, again, we just want to be careful that we're not dealing with dangerous bacillus anthracis. So just continue to work under the hood. They grow pretty well. So commonly, quickly, you'll be able to rule out bacillus anthracis. And then again, so for gram-negative rods, commonly we see E. coli and Pseudomonas species. These gram-negative coccobacilli and these diplococci, again, you're going to want to move your work under the hood just to make sure you're not dealing with something that's a little more serious than you want to be. Here is where we're working in the BSC. Any of these on the gram stain. A big giveaway is if you look at that culture at 24 hours and it's not growing, and then there's some light growth at 48 hours, you really want to work those up under the hood. Your bacillus species will grow very quickly. So for some reason you are looking at the plate around 12 hours, you'll see a lot of growth on there. But these are keys to begin your rule out and refer workup. So you do everything under the hood, tape the plate shut so no one accidentally exposes themselves. Presumed fungal or mycobacterium specimens, stay under the hood. Procedures that emit aerosols, this would be like your blood culture bottles like we talked about. Opening up a cytocentrifugation capsule that can emit an aerosol. Be careful with that stuff. And then anytime you're dealing with a direct specimen, you want to do that under the hood. So following our laboratory procedure, notify your supervisor, get a hold of Nebraska Public Health. The attending physician and infection control need to be notified at your location. And some things will require the notification of county health and state epidemiologists. So we'll just have a look at some examples of some gram stains now. Give you a second to look at that. This here is pretty classically gram-negative rods. And we don't really mention arrangement, we just say it's positive gram-negative rods. So here's our diploids again, stacking, palisading. This here is a little trickier. So here we have some precipitate. So these things here, we're not going to pay attention to. These here, this is homophilus, this is our gram-negative coccobacilli. These little ones in here. So looks like there's some regular gram-negatives in here too. You want to, like, what we're looking for here is the good stain on this. If this had been a lighter stain, it might be really hard to
Sure.
pick out.
And just to add, Ben, that the gram negative coccobacilli, that's the thing about Haemophilus influenza. Sometimes it can actually do weird things, like you can on occasion see a little gram negative rod in there, and yet it's still the Haemophilus too. But on the other hand, you have to be ultimately careful is, are they truly mixed in with a second organism? So that's where it takes going through the slide a good 25 fields and making sure that what you're seeing is either truly different or maybe just coincidentally that same Haemophilus influenza. So good point.
Right. Here we've got some large gram-positive rods. You can see in these the spores in the middle there. Good example of those. This is nothing. At first glance, you might think it's gram-positive cocci clusters. It's more black than it is blue or purple, and these shapes are very irregular. So this would just be junk on gram stain. Here are some of our big, we're saying boxcar shaped gram-positive rods. These are large squares, rectangles. They're pretty noticeable. So this next one.
Oh, and just to point out the decolorization part of it. Yeah, pretty obvious.
So on this slide, we're looking at over decolorization. These are yeasts with gram-positive cocci in clusters, which you can see as they get over decolorized, they can start to look, they can start to look like your gram-negative cocci, but your gram-negative cocci are going to be smaller than staph. But you can compare the size of the yeast of gram clusters, like we did here.
Yep.
And then these are also yeast. As yeast get older, they have a tendency to take off on you. So you'll see those long formations. And I think that's the last example we have, except for this nice. Did you sign that over there?
Yes, all right. And thank you. You did a fabulous job in going through all of that. So we hope this helps. I think that the quality control part of it is really important in your laboratory. I am a big believer that you should have some sort of competency system set up in your laboratory. And that doesn't mean just doing proficiency testing. And most of us always do, maybe 3 times a year, have CAP or API provide any type of proficiency testing. But what I'm talking about is competency, where you set up your own training and your own testing of your employees. This is where you're going to get a really good idea of how your employees are doing and how well they're reading. Another way to do it is to set or go through those gram stain reports, as Ben noted earlier, that you can usually a supervisor or a manager will review all the reports. Well, if you've got a report of a gram-positive cocci, but yet nothing growing in the culture, you might want to review that culture again and that gram stain again. You keep gram stains for several days, so that makes it available to review even days into the culture. Other things that we recommend is that, like we said, if you've got certain floors or certain clinics, whatever that might be, a problem, and they constantly send, poor specimens or problems with wounds not being collected correctly, have your either you or a pathologist even or director of your laboratory call that clinic and ask them to correct the situation, possibly even asking them to talk to the physician. Sometimes that's where physician to physician is actually better too. All right, so those are some highlights. We want to ask you what some of your questions might be in doing gram stains. What do you struggle with? What are the things that you have questions about? You're welcome to put it either into the chat or go ahead and just simply unmute. We love to hear people as they ask their questions. So any questions? There's got to be one or two.
Hey, Karen, this is Ashley Collins.
Yes.
I have a question, and of course, I don't have any specific examples anymore, but I'm wondering if there are any resources available that would be similar to that pathogens in blood slide that divides the most common bacteria found by source, and maybe even includes things like you should be concerned if you think that you're seeing this because it's clinically impossible. That might give a clue to the generalist that perhaps they, over decolorized or something, because that's not something that you could possibly see from whatever source.
Right. Good point. So, Ashley, what we have here, Ben has just brought up a couple of slides here that what I have done in the past is literally print either just this slide out. Ben, what's the next slide? Isn't there another one that says the sources, like the spinal fluid? What are the common, keep going. I think it might, oh, is it back? Yeah, there. So these two slides too, we can print out, or you can just simply print out. Yeah, the whole presentation is available to you. But what I've actually done is I have taken these and enlarged them by an 8x11 and placed them right near the scope. So people can look at these and say, okay, these are the most common bacteria that we see in a 1-month-old neonate, or this is the what we see in an adult, or something of that sense. So we can share these with you. I can even laminate them if that will help you. There are other resources out there that we could eventually share with you. We don't have them available right for this day. But I know there's a number of books and resources that can show these as well. So we can get back to you on that. Is that helpful?
I think so, yeah. I definitely like the idea of having these slides that you have with the examples printed off and available. And then, yeah, if you have any other resources that you know of that you could share, I think that would be great.
Yes. Oh, sorry, we're having, we're playing around with the reverberation. Maybe I just need to mute my.
I can't hear you now that you're muted.
No. Now can you hear me, Ashley?
Yes.
Does that work better? No, it's still reverberating in it. Anyway, what I would say, is it better? Okay, so you're taking it off. So what I would recommend is also having what's called a resource or a reference box. If you do have CAP or PULA or API PT slides, once you get the answer, you can relabel the slide and put that in your reference box and have that right there by your microscope, so that if somebody wants to compare a listeria to a gram-positive rod, and you think that would be easy to differentiate, but to many people, if they're looking only at listeria or only at a gram-positive rod like bacillus, sometimes it can be hard to tell the difference. I've had people call listeria, actually call it a bacillus species. And that's not correct because they are two different sizes totally. So if an employee or staff member can, if they even question it, they can grab both slides, look at them side by side, and then make a better determination of what that particular slide is. Becky.
I also wanted to add that when you're training a new employee, you probably should, just like that, have a box of slides
Exactly.
sitting there for that new employee to go over and read them and write their results out, and then see if it compares to the results that were sent out by the laboratory.
Exactly. That's the very good point. In fact, you can take it one step further and make them go through the whole reference box and then start making pick through already previously read gram stains
Yes.
and ask them to read those as well and check their results against the results that of the previous report. So very good point. Other questions? All right. Well, Ben, let's go through real quickly how the rest of the class will work. We will definitely get those resources out to you again. Yeah. In fact, this afternoon. Yep. And then we will, it's up to you. We will send you a link to a practice assignment. But that practice assignment does give you spontaneous answers. So good way to practice. What's that? Yeah, not graded. So it's like, again, just a kind of a practice session, but then it'll go into the exam. So the exam exists of how many questions, Ben? 20, 25?
There are 10 questions.
That's it, 10 questions.
Correct.
Yes. So once you've completed the exam, we hope that it'll be 80% or better grade wise, and you then will get the PACE number to do your CEUs with PACE. Now, don't panic if you don't get that. That is something that we can work with you with. We will probably go through just some issues that corrections we need to help you with on the exam itself. And then after that, you can take the exam again. So anyway, yes, you've got 1 month to do this. It's not like you have to take the exam tomorrow by any means. Ben's not as hard on his students as I am with my packaging and shipping. So, but with that, yes, if you want to look through the resources, practice, if you want to go through previous CAP surveys, great way to practice, and then do the exam. The exam is open book. We just ask that it's not open to ask other people questions or answers, ask for answers. So that's how that'll work. If you question it anymore, certainly you're welcome to give us a call. I think on that first slide was all of our email addresses, right? Did we have our phone numbers on there too? Yes, so you're welcome to call us here for any future questions. So, all right, any other questions? This is your last chance. And again, I want to thank Ben and Becky for putting this together. This is always the best training, I think, when it comes to gram stains, because this is where it all begins. And I think this is probably the most important thing and will always be in the microbiology world, despite the fact that we're going to molecular and many, many things. A gram stain will still hang around for quite a while. All right, with that, we appreciate your time and you are welcome to disconnect. Bye-bye now.